All right. Good afternoon, good morning, good evening, whenever you're watching this episode. My name is Cody, and I'm the host of Behind the Premium. And have we got a great topic set up with a great lineup of panelists to jump into today's discussion. But before I do, let's just kind of give it some context and kick it off right. So, starting off with a great question of what if the benefits that you're providing your employees are actually setting them up to fail? Right now, we have over 100 million Americans that are in debt, medical debt to be specific. Most of them are insured. 31 million Americans borrowed money last year just to pay for their healthcare bills. And 1 in 4 employees can't even explain how their own healthcare plan works. So definitely got a great lineup of questions to ask brokers and some other healthcare leaders. We'll have a few other people joining us as well. But let's kick it off and go around the table here. We'll start ladies first. Monique, if you want to go first and introduce yourself. Kind of tell us why you're an expert in the space.
Thanks for having me, Cody. My name is Monique, and I work over at Weltrio, and I'm a benefits advocate there and a health coach. So I work with individuals one-on-one. So I really intricately know the struggles that people are having with understanding their health insurance and how this impacts their financial situation, like Cody was saying. So I'm excited to be here today.
Awesome. Well, thank you. We'll go over to our next guest, John. Go for it.
Yeah, thanks, Cody. Always good to be with you guys. And what a great topic. This is something that we all need to spend more time talking about. John Knutson with Knutson Benefits Group. I'm an insurance broker. I've been in the business for 21 years, helping companies of all different sizes trying to navigate this space. And then the next step is trying to educate those employees on what they have and how it works. So excited for the topic to jump into this.
Yeah. Thanks for being here as well. And you definitely hit it on the nose. It's something that a lot of people aren't talking about. And it's shocking that they're not talking about it as well. So joining us as our other panelist is Rhonda. How are you?
Doing great. How are you, Cody?
Great.
Just
go ahead and introduce yourself.
Rhonda with Weltrio. I'm excited to talk about this topic. Definitely is a problem facing anybody who uses healthcare and the people who don't know how to use healthcare and therefore not using it. I'm excited to talk about that today.
Awesome. Well, thanks for taking the time out of your busy schedule. You know, you're extremely busy. Speaking of a busy person, let's jump over to Jacob. First time what is it? First time listener, long time listener, first time caller type of deal.
Yeah, something like that. Yeah, Jacob, excited to be here. I think this topic is just the core of what Weltrio works on and focuses on. I don't think anybody wants to misuse their benefits plan and go into debt over it. And so they lack a lot of education, and that's what Weltrio does, and I love it. So it's a great topic.
Perfect. Well, as you can see, we've definitely got a lot of people on the panel for today's discussion. And it should be a good one. As I mentioned before, with 31 million Americans borrowed an estimated $74 billion just in 2024 to pay for healthcare. I'd be shocked to see what the number is going to be in 2025. And you know what's surprisingly is that a lot of these people don't even really realize. We mentioned 1 in 4 don't feel confident in explaining how their healthcare benefits work. And I know that this is a problem not only for HR but also for brokers. I guess this first question just kind of gets shifted over to John. I mean, this is a big issue. Where you have a lot of people that don't even really realize what they're getting into when they go see the doctor. There's an episode of, if you've ever seen Parks and Rec, one of my favorite shows, there's an episode on there where Andy and his wife go to like every doctor because they think they have this magical insurance card and they're racking up all these bills that they didn't know are going to come towards them. So I know they're not the only Americans, but that are facing this kind of thing. But how do you go about that, John, from your perspective of trying to educate not only the brokers to pass on to their employees, but do you take a lot of the phone calls as well?
You bet. Yeah, we're always trying to help our clients navigate this space and helping them educate their employees. What is most frustrating is when employers are not giving us access to their employees. We're all busy, and so I certainly sympathize with that. But health insurance is really important, and so especially if you were to make a change to your benefits, and then just roll this coverage out to people without adequately explaining it, that really creates a lot of heartache and trouble. We just came across a group just last week, in fact, that was talking about this, that they made a switch to a health plan. Why? Because the price was so much lower. And they all jumped in and were excited about the price, but their employees had no idea how to use this plan. So we're trying to help them to say, look, yes, maybe your broker has some part of the blame here, but you as the employer also needs to give time and effort and access to their employees. Let's have a group meeting, even a virtual conversation, providing them with the information and the tools that they need. Otherwise, they're just walking around with coverage that they think will work, and yet it doesn't. So it can be really challenging.
Perfect. So that raises the next question, and anybody can feel free to jump in at this point. But, we call it a healthcare system, but the more I get involved in understanding this broken system that we call a healthcare system, I honestly am starting to become a conspiracy theorist that I feel like it's actually designed to keep people in debt or not really healthy. Especially when we look at the statistics that 36% of American households are carrying medical debt right now. Again, to me, that seems like a system failure rather than a win. Do you guys agree? What's your guys' thoughts on that? Do you think it's a great system, or do you think it was designed specifically that way to keep people in debt?
I'll jump on that first. Oh, no, go ahead, Rhonda. Go ahead.
I don't think it was ever designed to keep people in debt, but the costs have become so astronomical that businesses just can't carry that load alone anymore. So they are being forced to hand off some of that to the employee, and the employee, like when we have it's about $10,000, which is the allowable maximum out of pocket for an employee now. I don't know about you, but I don't have $10,000 in my pocket I can fork over if I have a medical emergency. So I'm going to have to carry debt. Yeah. I don't think that was how it was intended. I don't think it's designed to keep American people in debt, but that's certainly what's happening. The law of unintended consequences is what I like to call it.
Unintended consequences. I like that.
I'd like to add my perspective on this a little bit, because I think I don't think the system was designed, like Rhonda said, to keep people in debt, but I do think the system maybe wasn't designed to protect the consumer. And so you have a lot of conflict of interest at the top. And so you have people who are making decisions at, government entities that are guiding our healthcare, guiding our nutrition, or making recommendations that directly conflict with, maybe they're on the board of other companies that produce medication or, pharmaceuticals or different things like that. And so now you start to create a conflict of interest that is not visible to Americans. And so as the system grows and evolves, naturally there's going to be, maybe people aren't intending to hurt anyone, but they're making decisions in their best interest, right? And so as the system sort of proliferates, you end up with these problems and things cost more, and they're getting guided by boards or entities that make money on the other side of it or based on their recommendations. And so I think the system is a little bit broken, but I also don't think anybody's evil, in it. Individuals are trying to do the right thing. I really believe that. It's just not functioning well, I think, for the average person right now.
Yeah. I would add to that what Jacob's saying. You know, you have these people at the top that are making these decisions, and maybe they're being made for like the mass amount of people, right? Or this larger group of people. But there's that trickle down effect, and it's not a one size fits all. And so when you don't have a one size fits all, you have some people that are more financially impacted by these decisions than others. And they're not necessarily the ones who are getting much of a say in the decisions that are being made at the top.
Makes sense. John, do you have anything you want to add to that question, or?
Maybe just briefly, I just, sometimes we call it the healthcare system, and we almost, paint the picture like somebody literally or some committee got together and actually designed what we have today, where that's not how it's been. It's this piecemeal approach that every few years we get this other bolt-on piece to it, and it's really messy and confusing. And I don't think anybody intended for that, but it's just the way that it happens. And over time it changes and morphs, and it's leaving a lot of people damaged and hurt along the way, from what I can tell.
So you bring up a good point there, that it wasn't intentionally designed that way. A majority of you guys said that. So where did it go wrong? Like, what was implemented that you guys feel caused us to be where we're at today?
That's a loaded question.
That's tough. Or easy.
There's so many places where it went wrong. There's some things that were implemented that I think have helped the American consumer. The removing lifetime maximum for the few at the time when that was lifted, for the few that impacted, it made a massive difference. I mean, if you can imagine, there are people now who can spend $1 million a year in healthcare based on their health condition. And if they had the maximum lifetime benefit of $1 million, they would not be able to afford healthcare. But healthcare has become so much more expensive since that was implemented that insurance companies can't even take the risk that insurance companies are trying to cover. It's just so messy. I think we had a big faux pas when we forced everybody to buy the same benefit. We don't do that with any other type of insurance. If you are a good driver, your car insurance is less than somebody who is not a good driver. If you are a responsible homeowner, your home insurance is less than if you are an irresponsible homeowner. And so that we took those bumpers away from healthcare. If you are a responsible, healthy individual, you're going to pay just as much as somebody who is on dialysis and has cancer and they're, limping along. That's just not fair. So costs went up to meet the demand of the people who are costing too much, and everybody gets to pay for it instead of kind of rewarding those who are doing things right.
Makes sense.
Well, and I would also add kind of where you're saying, where did it go wrong? But I think there's a spot where it went wrong and right at the same time, where we're in a time where there's all of these things coming to market and new treatments and all of these new things that we're exposed to, and they come to market really, really fast, and they end up being very, very expensive. So in this great time that we're in, where we're given more tools, these tools aren't becoming cheaper because there's so many of them and they're being put in for us to start utilizing. So how do we subsidize the amount that's coming in with the amount of money that these things are costing? So a wonderful side for innovation in healthcare, but the cost side of that hasn't been able to keep up.
You want a specific example, Cody? This is fascinating. Some years ago, so decades ago, we really didn't have all of the medications that we have today, right? We're seeing, we were commenting on how many times do you see a pharmacy medication commercial on TV? Like we're being marketed to now all these different drugs, and back in the day that really wasn't the case. And what we dealt with back then was that people would have rare illnesses, and they would only be a handful of people that had these illnesses, and the pharmaceutical companies they didn't have any incentive or interest in going out and creating the medications to help these people because there were so few of them. And if you're not going to have, I mean, any business is going to look at that and say, look, we can't, that's not a profitable venture. Like we're not going to spend our time helping just this small group of people with the conditions they're dealing with. And so some legislation passed that allowed pharmaceutical companies to charge essentially whatever they want for medications. And so, and that was, the purpose of that was then to incentivize the pharmaceutical companies to do the research and development to find solutions for these rare diseases. And so sure enough, they have done that. And they've got wonderful medications now that are changing, saving lives and changing many people's lives. They're miracle drugs. They're wonderful. The problem is we're now dealing with the expense of all these medications. And so we've created a bit of a monster that way, because we told pharmaceutical companies, in order to incentivize them to create the drugs, they can charge whatever they want for it. And so they're taking full advantage of that. And the expenses are astronomical now. And so now we're trying to rein that back in and come up with measures to control pharmaceutical expenditures. It's a tricky deal, because you talk to anybody that has a major chronic condition that is, even if some of those rare ones, that their life is changed or saved by these medications, man, they're going to tell you it's worth every penny. But at the same time, how do we pay for all this?
Yeah, it's very interesting because, in my research for this topic, as I mentioned before, most people believe that if they have health insurance, they're covered, they're protected, right? But some of the stats that I was pulling up, it was stating something like 23% of insured working age adults are considered uninsured, meaning, that their coverage fails them at the moment that they actually need it. And so, for me, along with the prescriptions, when people can't afford it, is that another driver as to why we're seeing increased healthcare costs across the board? Is because people are underinsured, can't afford it, they're just not able to cover it? Could that be some of the gaps we're seeing being created?
Yeah, I think so. I mean, I was going to bring up another specific example, and you always like my hot takes, right, Cody? This might ruffle some feathers for some, but a controversy that I keep bumping into is this concept of the HSA. The HSA has been such a good thing, and I won't argue that. There are good things that have come about because of HSAs. We're all more wiser consumers because of HSAs. But at the same time, there's a problem here, and it's that we have these gigantic deductibles every single year. So for folks that are constantly dealing with issues, you're going to have, what was it, Rhonda, $10,000 now that I have to pay every single year. I could be the wisest consumer and still have a very severe chronic condition and still have to pay out that same $10,000 every single year. And the number keeps getting higher and higher. We're talking about medical debt today. How can insured individuals have astronomical medical debt? It's because their health plans are making them pay more and more out of their own pockets in order to save costs on premium. This is a train wreck. This is really a problem. We need to find ways of getting things paid for and covered in a smarter fashion, and not just push it all off onto American families to just try to scrape together money and try to solve it themselves. This is an unintended consequence that I think needs to be looked at more closely.
Yeah, I have 2 follow-ups to that, but I want to hear what other people have to say on this.
You could disagree with me, guys. That's okay.
I love your hot takes, John.
I love the hot take. I want to push back here with my experience with HSAs. I have a large family. I have a bunch of kids, and I engineering background, kind of a nerd, and so when I was choosing my corporate health plan years ago, I did a lot of spreadsheets comparing HSAs with their PPO, with all the different options that they offered. And I actually ended up there was no scenario that I was more out of pocket with an HSA, which, and I think the out of pocket was like 8,500 back then, which to your point is like pretty crazy that I have a health plan and I still might have to come up with $8,500. And then it's like 20% or something like that for the, the over limit. I can't remember all the details, but I remember the PPO would have been more expensive. There was no scenario the HSA was more expensive in. And hearing you talk about the HSAs, I'm like, man, that makes a ton of sense. And then I think back to my experience and I think, wow, it really is broken when that makes more sense. Because obviously my employer was trying to offer on their PPO plan, they were trying to save money. So they're making it not as good, right, to get people on the HSA so that they're paying more, on their end out of pocket first and just trying to manage their finances. And yeah, it's broken.
Yeah.
I have a little different take. I think there are some predatory practices going on. I think the consumer is not aware how properly to use the plan. So when they have all of these incredible prescriptions and they're advertised nonstop on certain networks, certain channels, we're only one of 2 countries that allow pharmaceutical companies to advertise directly to consumer. I think that that's predatory. The second is those drugs, those new amazing drugs that help kind of the underdog get better, the people who don't have the disease of the masses. Pharmaceutical companies capitalized on that and started making as many new drugs as they could, even if it wasn't necessarily going to benefit the individual. So 2 examples. One, they make a drug that is a new drug and they test it, and the tests just determine if it's good enough or won't hurt people and that it's helping. But they don't test it against current treatments. So if you have, for example, an aspirin, which is one of the best painkillers out there, but has some side effects that concern people, and they make this brand new pain medicine, and they say this works, this is effective, they don't test it against what's already working. They only test to see that it's effective. So the second thing they do is in order to get a new brand name drug, they take 2 generics like hydrocortisone and valcyclovir for a cold sore. They put them together, both generic drugs, both very inexpensive. They put them together, this new compound, hydrocortisone plus valcyclovir, and it's now a brand name drug, and they charge $800 for literally like a quarter ounce to put on a cold sore. Or you could wait it out, or you could buy hydrocortisone and valcyclovir and it would cost you $15 and you could use it. So it's not benefiting the consumer really, but the doctor says, hey, I have this new drug, it will help your cold sore. And so they have $800 out of pocket for this quarter ounce tube of medication that they could buy the separate parts for. So it's predatory. The pharmaceutical companies are maximizing their ability to make profit, and the consumer doesn't understand what's going on in those cases, and a victim is what I would say to the system.
And I would add that it's predatory in the fact that we in healthcare and those people, writing these prescriptions a lot of times, and the pharmaceutical companies and pharmacies have that education, but it's being withheld from individuals when they go to fill these prescriptions or prior to filling the prescriptions. It's being withheld. And that's really where I think it becomes predatory. We know there's an option that could help avoid a debt crisis for you, but we're going to suggest this first. And until you ask us otherwise, this is what you're going to get from us delivered to you. And I think that is really where we run into this lack of education, but it's because a lot of the education is just being withheld.
Interesting. Yeah, because I was going to ask the follow-up question is it the healthcare system that's making most U.S. citizens go bankrupt, or is it the individuals that are making the decisions for their healthcare, like Rhonda was saying, getting that $800 ointment because their doctor's telling them to, and they're the ones that are going out making this decision. So really, who's at fault here for causing that debt? It's interesting because, one of the stats that I was reading upon, that medical related issues or family changes, such as like a catastrophic event, 72% of all bankruptcy filers in the US are medical related or health issue related in some way, shape, or form, which is kind of concerning to me because most Americans are already living paycheck to paycheck anyways. And to Rhonda's point, who has $10,000 just laying around that they can pay for that deductible or pay for that bill right out of the gate? And so it goes back to that question I just asked: who's at fault here? Is it the employee that's making the decisions, or is it the healthcare system in general?
It's all of the above, and it's worse than that, because the consumer, the employee, is responsible for the first 10,000, but that means the employer or the fully funded plan is responsible for the next 100,000, 200,000, 500,000, and then that is going to increase the whole company's medical rates next year. And then everybody's premiums go up, and then our out-of-pocket continues to go up, and companies are like, we have to have a less robust health plan because we can't afford these increases. So 10,000 is the ceiling if you are working within the plan perfectly for an individual. 20,000 for a family, sometimes 30. If it's out of network, it can go way up from there. But the ceiling, there is no ceiling. The costs are ridiculous. So all of the parts are broken, and collectively we're creating this very difficult situation to monitor and to navigate, which is really where John is super helpful in helping people understand their plans well, and Monique and Jacob, Weltrio, super helpful to help people understand how to use the plan as it exists so that they are getting the most impactful care for the least impact to their wallet.
Well, and you were asking, Cody, about where do you place that blame? And I would hate to place blame on someone who's ill and then is being told you need this prescription and is trusting an expert that they're giving them the best option. I think my hope is always that everyone is going to act with the best interest for everybody else and be the most honest, and they're going to have everyone's best intentions. Everyone's going to have the best intentions. And so if you're in a situation where you're filling a prescription and you're very ill, you're not going to be questioning necessarily if your provider or if who is prescribing this for you has your best interest financially in mind, or if there even is another option, because you're viewing them as an expert in your health. Especially when you're in a time where you are really vulnerable, generally when you're filling these kind of prescriptions or having large cost procedures and things like that. You want to be able to rely on these people with expertise. And so who's to blame? I don't really want to say that there's one or the other, but I would hate to place the blame on an individual who's ill in the moment and trying to do what their healthcare team has advised them to do.
Right. Makes sense.
It's like we're playing whack-a-mole, it's like, everybody, everybody needs to improve is the answer. Everyone carries blame. Everyone needs to improve. And it's, just knowing where to start and how to get going, I think is the trick.
Exactly.
There's a kick the can problem as well.
Mm-hmm.
Yeah.
The sick individual goes to the doctor. The individuals this happened recently. The individual is desperate. They've tried everything that they've known how to try, and the doctor says, let's try this new drug. Let's try this, maybe this one will help. They get their prescription. The doctor doesn't fill the prescription. The doctor doesn't know how much the prescription costs, and the doctor doesn't understand the insurance that all of their patients have and how it's used best. So then the individual, literally this just happened this last week, they take the prescription to the pharmacy. They sit there and wait. They're desperate, the individual. The pharmacy says, oh, your insurance, we don't cover your insurance here. Drug is going to be $500. What? Like, okay, where can I get it filled? Okay, move it. Move the drug to the pharmacy that will cover it. But it's a controlled substance, so the pharmacy can't transfer it. So you have to go back to the doctor. Doctor has to send it to the right pharmacy. then it's expensive prescription, so they have to wait 24, 48 hours because the pharmacy doesn't have it in stock. So now the pharmacy's ordered it special for you. Insurance is going to cover it. They present it, and actually insurance doesn't cover this drug because it's too new, to John's point about new drugs. So it's still going to be $500. The patient is desperate. Does the patient know they can say, I'm going to use a coupon, and now it's only going to be $135, but still insurance isn't covering it? Or are they going to just be like, oh, I don't know what else to do, and I'm desperate, so I'm going to pay the $500? So a phone call to me, Weltrio, and they're able to at least get the drug for $135. Like, don't keep it at that pharmacy, use a coupon, and then let's rethink this in the next 30 days while you're trying this new prescription. Let's come up with plan B so that we don't find ourselves in this situation again and can get back into a drug that's covered by insurance or a generic. It's super frustrating. The doctor's not doing anything wrong. The patient's not doing anything wrong. The pharmacy's not doing anything wrong. Insurance isn't, but collectively, people are getting mixed up and lost in the soup.
Yeah.
And to what Rhonda's saying, when you're in a situation of desperation, and you are struggling, or you've tried everything and you are in pain, or you are critically ill, right? You're not even thinking about, well, what are my other options? You are hoping that someone else has your best interest, right? I think about this often. We live in a small town where life flight is common. You get a cold here and they're going to life flight you somewhere, essentially, right? And so if you don't have life flight insurance in that moment when they're telling you, we're putting you on a helicopter and you need to go to a bigger facility, you're not thinking about, oh, I guess I should have got life flight. Maybe I should stop and tell everyone to pause and I can figure out my insurance right now. That's why you have teams like Weltrio who suggest these things when we know that you live in a town like this, and we talk to you about these things and are proactive in your health. Because in a crisis situation, out of desperation, poor decisions are made, or you have to make decisions without being able to put all the forethought into it in that moment.
Yeah, that makes sense. Yeah, it was kind of funny because the last Friday, Jacob and I were doing a podcast, and we were talking about adding Weltrio coach as their main point of contact, emergency contact. Because I'm like thinking, can you imagine all the cool stuff that they could do while you're just off, like trying to get treated? They could totally get you taken care of, that's for sure. But no, that's funny. So Jacob, this one's kind of thrown to you since you're being a little quiet, sitting in the corner. We're going to circle back on the education. I think that's a huge thing. But the one thing that I did want to touch base on is the ever-growing AI kind of, I don't know if you want to call it a fad, a trend, the new wave of where a lot of industries are moving towards. We're starting to see it creep into healthcare quite a bit. How do you think that AI is impacting the rising costs of healthcare?
Man, this is a tough question for any industry, let alone healthcare. I have a lot of mixed feelings on it, and so I'll do a John hot take maybe.
Here we go.
I think there's a lot of opportunity for AI to be wrong in healthcare, and when AI is wrong, it is really expensive. And I don't have examples of where I think it's wrong, but right now, but I can see, because understanding AI, their inference models, they only know the data they've been trained on, and every human is unique. I mean, look at it, look at DNA, look at hair color, like every single person is so unique. It's hard for me to believe that from a health standpoint, we can really get that good with AI. That's kind of my hot take, because everybody has unique things. And unless we're, I need to caveat this with, sure, someday the models will be big enough, there will be enough compute power, everybody's DNA is going to be loaded in a database somewhere and they'll be able to make these predictions. But I just don't know that I see it being realistic in like the usable future for us. And so I think there's going to be a lot of attempts to use AI to do different things behind the scenes in healthcare. John, you're probably familiar with AI being used for underwriting. We've talked about that a little bit, because you take a population of people, and it's interesting that populations can be pretty easily categorized, right? So I think from like a group standpoint or like an underwriting standpoint or an administrative or system standpoint, if you want to take a bigger picture look, I think AI has a lot of, unique applications. I think there's a lot of individual learning that can happen with AI. I think if you're into this, you've read articles and white papers on AI is being used to identify disease early through DNA. AI is being used to discover treatment modalities that didn't exist before. But I think using like replacing a doctor with AI just seems like a little bit of a stretch to me, because people are so unique, and they're not even just from like a science standpoint or like a biology standpoint, just from like a personality standpoint, they're going to want a different type of engagement with their doctor. And I think, this sort of leads into one of the spaces we talked about this on Friday, where as AI gets more prevalent across industries and more embedded in people's lives, I think people are going to start to crave more human relationship. They're going to start to crave a personal touch and a personal conversation and somebody that knows them, and they want to feel known and they want to feel heard. And, I don't think AI can really get you there. And I don't know that it ever will, because you still know it's a computer. And so as that distance between humans grow, that's where I think personal touch is going to become more and more important. And there's the platform for kind of the Weltrio strategy, right? If you listen to our podcast from last week, just plug that real quick. But we talked about, that's where Weltrio stands out. Our coaches, Monique, you have an incredible relationship with your patients, with your members, because they love having that relationship with you. But we are working on ways for you to use AI in the background to make you more effective with that relationship. And I think that's really going to be the key, is keeping the human in the loop up front at the human touch point. And where can we implement AI behind the human?
Well, and I would say to that, like, yes, we can kind of code in these personality traits into AI to some degree, right? Like, we want them to challenge us, or we want them to be a little bit snarky, or however we want to kind of code their personality. But there's something that comes with an actual physical bedside manner that's human. And I've had people, well, who would you refer to in town for an OB? I said, well, it depends on the kind of bedside manner you're looking for, right? And what I know about each individual. And do I trust them to save your life? 100%. Do I trust them to put their hand on your shoulder and tell you you're going to be okay? Probably not. But if you are okay with a certain type of care, I can really kind of direct who you're going to like jive with and who you're going to have the best experience with. With AI, it becomes not always one size fits all, but it's conditioned to have the personality that we give it to in working with individuals. And so that necessarily doesn't touch everybody in the right way when you're trying to have a relationship in healthcare too.
Yeah, and maybe to expand a little bit on that, the human touch, I think, matters more in an emergency. When your tension is high, when you're uncertain, you don't know what to do. I just speaking for myself, I want a person who I feel like knows what they're talking about and is on my side. I don't want to ask Claude like about this rash, or whatever. I don't know.
That's actually Dr. Google. So.
Right. Yeah. We all Google our symptoms, right? But like for something major, you're going to Google because you want to be informed yourself, but you really want somebody you can trust to have the conversation with and sort of figure it out together.
Well, and I would even add to that, for example, as someone who has children, right? If I go ask ChatGPT or Claude, like, my kid is experiencing this and this and this, right? And they tell me something. But if I talk to a provider who's also a mother and their child has had that same rash and they went through that same situation, I feel much more calm than a computer telling me, well, it looks like this Google image and all these images pop up, right? I'm talking to a real life person who's experienced this in real time in their own course of their life with their children. And that personal touch, you can't get that from a Google picture being pulled up in a chat box. So.
And it's always like, congratulations, you have the bubonic plague. Wait. Oh, my bad. You're correct. I'm so sorry.
How many calls would you say you've had where the patient is like, I Googled this and fill in the blank, right? Like, it's probably almost all of them, but Google's not good enough, because they want to talk to a person they trust.
Well, and I
even,
think,
and even if Google is right, they want the reassurance from a real human, right? Like there is something that comes from that human connection of being like, I have stood where you stood. You know, I tell people I might not wear the same, I might not be walking in the exact same shoes as you, but I've walked in a really similar style at some point, right? And so that can be really comforting, especially in a time of severe illness or family struggles or health crisis or emergencies, to be like, no, I don't know those shoes, but I've walked in similar shoes and this is how I approached it. So
Love it. Rhonda, were you going to say something?
oh, I think you all are spot on. And when we talk about wanting to talk to someone we trust, that's usually someone we know.
Yep.
So even calling like telehealth, a telenurse, somebody, I would rather talk to somebody that I know who knows me, who can give me that advice.
Yep.
So where it's nice to talk to a human, it's even more comforting to talk to one that knows you.
definitely.
Yep.
Hey, you know, weren't you in Mexico last week? You know, because they know.
Yeah.
Yep.
A relationship.
Yep.
Yeah.
So I'm going to put out my hot take on this as well. I personally think that AI is going to be good, but I also think it's going to be a cost driver. And I say that because of being a UI UX designer of systems out there. One, the healthcare system scratches my head, but on the flip side of that too is once AI gets introduced to into these systems that the doctors and nurses and the hospitals and even just your average general doctor office is using these systems where it's like, hey, have you done this many blood tests? Have you done this many MRIs this month? It's almost like they're pushing them to do quotas. And I feel like that could be a huge cost driver in the healthcare space because a lot of people are getting procedures or even treatments done that aren't really necessary per se. And so I think having that humanized touch is also going to be kind of that stopgap or even that like little opportunity to kind of question Claude or some of these AI models that are out there, because at the end of the day, the big thing is they're only programmed to initiate and execute on certain things, and if they can't push a person towards that, then they're either going to fail or they're going to succeed at it. And where a human can do audible change ups and go this direction versus that direction, again, a lot of the AI systems aren't even prepared for that. And so for me, it's like a tool rather than an actual replacement for healthcare, navigation and opportunities like that. So. Anything anyone else wants to add to that before I move on to the next question?
Can I tie that back to how it can increase costs a little bit for us for just a second?
Yeah, sure. Go for it.
So if we're using AI, let's say we have an AI, whatever, a doctor that's telling us we need an antibiotic, right? Okay, usually if Rhonda, someone's prescribing you a prescription, go fill your antibiotic, let me know if you have any complications. If AI can become very predatory in that way too, if it's trained that way, I think, because it could easily get to the situation where it's like, you need an antibiotic. We're going to also send you in a yeast medication in case you get a yeast infection from this. And then you have someone filling 2 prescriptions. Instead of starting with one, connecting back with a provider, do I even need a second medication? And so you're filling additional prescriptions at additional costs that you might not even necessarily need. When if you had a personal touch, a personal provider who's talking with you and is like, okay, here's your antibiotic. If you notice these symptoms, then give me a call and then we can call you an additional prescription, as opposed to having 2 just sitting there for you. Maybe you don't understand why. And you're like, Claude told me I need 2. So I'm going to go fill these 2 prescriptions now. And I've spent twice as much money when I could have started with 1. So I think that predatory practices could leak into AI in this situation too and drive healthcare costs up.
Love it. Love it. Anything else anybody wants to add on top of that? All right. So kind of moving along, the next question that I had geared up is kind of along the cost of people carrying the medical debt, where it's only covering part of their service. So, walk in thinking we're completely covered. We walk out with a bill that we can't handle. And I think this kind of goes along to Monique's point of view is, our doctors are trusted advisors or trusted medical care people. And I think a point that Rhonda brought up earlier was, we're financially responsible as an employee up to a certain dollar amount, and then the business owner is responsible for the rest of it at that point. How do we start to protect both the employee and the employer? And I know that starts with education, but what is that education that you guys keep referring to?
I think we're all about to say the same thing. So we're just all waiting for somebody to say it. Go ahead, Rhonda.
We just use the system in the most inefficient ways. And if you understand and have a little bit of education before you need it, there's so much more efficient ways to use the system. And that benefits the employee and the employer. If just circle back to AI.
Provide some examples of what that might be.
Really.
Yeah.
The imaging is so good, and a lot of the imaging now is being read by AI and then reviewed by a physician instead of a physician reading like the CT scans. AI is picking up stuff that has looks scary, but there are no symptoms. That was not what was presented. The presenting problem didn't have anything to do with whatever they found. But now they have, because it was picked up by AI, they need to go down and do a whole new host of tests to determine that little aneurysm, maybe, that they find when they scan a shoulder and they see at the heart, like we're only looking at the shoulder, but there's a little aneurysm on the heart, and it measures 3 millimeters, and 5 millimeters is where you treat, and 6 millimeters is where you do surgery. Like, okay, now we have this dumb 3 millimeter aneurysm that they found on accident or as a byproduct of this shoulder pain, and they have to go investigate it. There's nothing they can do for it. They can't treat it. They can't surgically repair it, but they now have to investigate it because they found it. If like you're going to go in for a shoulder CT, they might find something, but don't pursue any additional treatment. Just treat this shoulder. If anything is found, let's talk about it with your primary care provider. Let's follow up with somebody that that knows your history and knows that this is not a presenting issue and this is not something to worry about. Somebody that who you can call and say, hey, they found this. What do I do? Do I go in and do the additional testing? Like, no, you don't really need to do the additional testing for something that they found on accident. We all have something going on that's strange in our body. And if we did a scan head to toe, we could get worried about it for a little bit, and they could do $20,000 worth of testing and find that actually we're just as fine as we were when we walked in. And AI is creating that problem. And people are being pulled in out of fear to investigate those problems. Hospitals are super happy to investigate them because that's just money in their pocket, and don't need to do that. We don't need to investigate things that are not creating a problem unless they find something that's, surgery worthy, or at which point you would be having symptoms.
Right.
And that kind of thing is happening all the time. I hear about them daily where people are like, they found this scary thing. And I think the stress from these things that are not creating any problems are creating more health problems than what they find.
Yeah, such a great perspective, Rhonda, and really is the core of Weltrio is build that relationship. Let's have the conversations. Let's equip patients so when they go in, they sort of know the questions to ask, or they have a resource that they can talk to when they come out, when they get presented with, you've got this 3 millimeter aneurysm. Well, talking to the doctor is great, but sometimes you want to talk to somebody you trust and get their opinion and ask some different questions. to be really skeptical of it, talking to the doctor about it is a conflict of interest, right? They're the ones getting paid for doing the work. And, I don't think anybody wants to put a doctor in the conflict of interest. You get the Hippocratic Oath and stuff like that, and they shouldn't have a conflict, but, in some cases they're just obligated, like you said, and just having a Weltrio coach or Weltrio nurse, your Weltrio care team to have the conversation with and get your head around what's happening is just so powerful.
And I would take that as an example for that. For example, what both Jacob and Rhonda were saying in a situation where, for example, Rhonda and I have been working with the same person for 8 years. We know their whole life story from the last 8 years. We know about their dogs and the new kittens and their grandchildren. And if they were to go on AI and say, I'm having chest pain, right? Or they call the emergency room and they're like, I don't know, I'm feeling really out of breath. Generally, they're going to recommend you come in, right? You're going to start to panic. That's going to increase your anxiety. But had they called maybe Rhonda and I, we know they have a history of anxiety. We also know that they just lost a grandparent. Their dog is missing. Their child is failing school. We know that their anxiety level is significantly higher than maybe an ER doctor does when they get that call, or a Claude does when it gets your text message, I'm having trouble breathing. And we can ask the questions to kind of determine what level of care do you need right now, right? Is this just, we need to remind you to breathe, and yes, everything is going to be okay, and your dog is going to come home, and we can talk to you about funeral plans if you just want to talk to somebody. And then a lot of the times we can be like, okay, see, it was just, you're having a rough moment, right? Claude doesn't know that. An emergency room doctor doesn't know that because they don't know your history. They don't know the intimate details of your life, of what you're going through, or even think to ask the questions like, is your dog still missing? Right? When we would ask that, when someone's like, I just feel so out of breath and I'm so stressed out. Okay, well, your emotional support dog has been missing for 2 days, right? They don't know that, but we would know to ask those questions in most situations. And so it adds kind of a buffer before you get into a situation where you're paying for this high cost healthcare when you don't necessarily need it. You maybe just need someone to ask the right questions before we direct that care. And that's where that personal touch versus AI kind of is the big difference in how we can save money too, and direct better care for you and make sure you're having that personal touch.
Yeah. And I think you brought up a great point, Monique, is the anxiety. That's the mental health tax that nobody's really talking about, is the anxiety, the depression around those kind of things. Because, it's a major thing to have that happen. And then if you have debt on top of that from, like a medical thing, if it's a reoccurring thing that you're constantly going into debt for, I mean, that's another huge reason why a lot of people avoid going to the doctor, is because they don't want to get into debt, especially if they can't afford it. And so, yeah, I think you hit it right on the nose there. That the mental health toll of what it does take on people as well. So,
and just not knowing how to navigate. Am I just stressed out today?
Yep.
Am I really struggling with a loss in the family? Am I struggling with, I'm going to school full time and I'm working full time and I just had a baby? You don't necessarily know where to go with that information or what level of care you need when you're in that crisis panic moment. And so you can sometimes default to situations that are going to cost you a lot of money when maybe we could have negated that situation in a much simpler way.
Yeah.
And much more cost effective.
Yeah, totally. I agree on that. John, I got a question for you. Brokers are often the first and only advisor that businesses turn to for healthcare guidance. But with today's topic and a lot of the blind spots that a lot of the employers are looking at making cost-cutting changes to their plans, do you feel, and maybe this is another hot take, maybe not, I'm just going out on a limb and hoping that it is a hot take, but I know that you're not representing all brokers in the fashion, but in today's conversation for today's topic, you are. Do you feel like there are a lot of brokers out there that when employers want to cut costs, that they're just like push it onto the employees because they know that when it comes renewal time, it's always the same thing: renew, premium increase, sign here, you're off to the races kind of thing, because they're looking at their commissions? Do you feel like brokers could be part of the rising costs of healthcare as well?
we could we could have a whole podcast episode just on you, Cody.
Let's do it. Let's do it.
Let's do it. Yes, I mean, to answer your question, absolutely. Brokers are typically working with business owners, CFOs, folks in HR, and what are we doing? We're spreadsheeting options. We're looking at costs. We're looking at benefits, but it's so numbers driven. Often it's just trying to get to some financial end goal, and we quickly will suggest a higher out-of-pocket maximum. You won't have barely any employee that ever realizes that difference, but look how much we can save in premium. But what we've just done is we've held that one family out by thousands of dollars more than they were previously, and that's devastating. And so what seems like a shrug of a shoulder and oh yeah, this is a great way to cut cost, it really can be detrimental on these families. So I think there's a lot to be said about that. And yes, there's some brokers that have commissions tied to a percentage of the premium. So they don't have any incentive to try to get the cost down necessarily. If they're really good friends with that business owner and know that he's not going to go anywhere, maybe they like to see the premium go up a little bit, so they get paid a little bit more every year. I hope that doesn't happen, but I'm sure there are instances where it does. And I was even thinking too, Cody, if I can set off a little bit on the previous question, there's a lot that we can do with creative plan design to help with this situation. And that's really my world, where we're stepping in and trying to help companies navigate this and provide great benefits for their employees. We're seeing some amazing innovative approaches to healthcare right now, where instead of the traditional model where you have all the deductibles and out-of-pocket maximums that employees have to pay before they get benefits kicking in, we've learned that doctors, hospitals, clinics, they all hate health insurance about as much as anybody else in the world, and it's because they get paid very little, and it takes them so long to get paid. And so we have some awesome strategies that we can introduce to companies where the health plan steps in and makes payment up front to doctors and hospitals and clinics. And when you do it that way, and when you eliminate all the administrative hassle of a health insurance plan, but you just present to the provider a payment up front, they are deeply discounting their services. I was talking to a back doctor just last week, and he said that he had some patients that were getting a procedure that would typically be billed at $160,000 for a typical health insurance plan. But when we approached the doctor up front and said, we could just pay you right now up front, what would you discount it? The discount was $40,000. So he dropped it $120,000 because we were able to come in and make payment up front. I mean, that's real money. And the way we structure these plans is that the discounts are so great that now employers are offering health coverage to their employees, and the employees pay nothing for their health care. They go in and have babies, have knee surgeries, have back procedures, and they pay nothing for their care. It's 100% paid for by the health plan, but also achieved wonderfully by these great discounts up front. So just a little plug there to say it's a big world out there. We've got some creative things happening in healthcare, and we'd love to show you how that can look for any company.
I know we only have a minute left, Cody, but can I just kind of tag on that with John for just a second? The plans he's talking about. Yeah, one of my favorite things is when I can talk about a plan like that with a young family, or a family has lots of children, for example, everybody, but especially these kind of families. But I can be like, hey, guess what? You can actually budget for your healthcare because you've paid your premium, whatever, your company's paid whatever up front. And you know that you don't have to meet a deductible now. You know that you can afford to go to the specialist because you don't have to be like, do we have that money in the bank? You've already been able to budget these things ahead of time. You know that they're taken care of. And that alone allows people to avoid debt crisis and allows them to avoid healthcare costs way ahead of time because they already know that these things are taken care of. So it's like one of the most exciting things that I can share with people. Like, you don't know if all 6 of your kids are going to get sick next week. And do you have all this money for these copays? And have you met everybody's deductible? And these plans that John is talking about, this creativity that he's like implementing and putting into these situations allows for people to know that they can access healthcare and plan for the future without being like, how much debt are we gonna accrue if everybody gets the flu this year, right? So I think those are just really, really exciting opportunities, what John's talking about, and how we can share those with people and companies bringing that to their employees.
For sure. Jacob, Rhonda, anything you guys want to add on top of that?
These plans sound exciting.
All right,
Learn
Rhonda.
more about that.
Yeah.
Can budget
I
for
just-
all those kids.
I just want to add quick. I mean, we work with John on a couple of different projects, and it's been awesome. I mean, you're not kidding. There's a ton of creative things happening in healthcare. It's wild. And I love that you're in the mix and in the middle of it, and appreciate working so closely to figure out some of these creative solutions for our clients. We've got some clients on some pretty creative plans like you're talking about, and it's just awesome for them. And so it's an exciting world right now.
It really is. Yep. My kids think I have the most boring job in the world. They're like, "Oh, Dad, health insurance. My goodness, don't tell me anything else about it." I'm like, "No, man. I guess that's just me being a geek. I love this stuff." Yeah, this is exciting.
I don't know. I get super excited when I get to share about these plans too, John. I'm like, you'll never believe this. My kids are probably like, what is she talking about?
Yeah.
I must be catching the bug, because my wife the other day was just like, is this a healthcare conversation? I'm
Please
like,
tell me
yes.
it's not
And she's
about
like, all right. No. I'm like, no, this is really, really cool. But, no. Someday I'll get her on the boat. That's for sure.
Yeah.
But anyways, I want to thank everybody for participating today. I know this is probably an ongoing topic that we could talk a lot about now that the healthcare debt is reaching over 100 million Americans, and it's hitting them every which way we can think of. And so I love the ingenuity of John and his team for creating plans. I love the ingenuity of Weltrio and taking a proactive employee engagement type of approach to not just band-aiding the problems and the gaps and the risks in benefit plans, but also trying to close them, starting with the education and the engagement with the employees. So some real innovators, some real thought leaders in the space here. Definitely check out Weltrio and check out Knutson Benefits as well, if you want some good solutions out there. So thanks again for everybody participating. We appreciate you guys, and thanks to our listeners and those that are tuning in through the live as well as the recorded. We will be here in 2 weeks for our next episode of Behind the Premium. Until then, be sure to check out weekly as we roll out a couple of new series over this next few weeks. We've got the Benefits 3.0, where Jacob and I kind of dive into the tech side of benefits. John, you're more than welcome to join us anytime on that. We'd love some of those hot takes from a broker side. Those are every Friday, and we have these roundtable discussions every other Wednesday at 4 p.m. So with that being said, thanks everybody for tuning in, and we will catch you on the next episode of Behind the Premium. Have a good one.